When you hear the word medicine, what do you think about? Nasty, yucky, life sustaining? Well, today we're going to dive into the medicines that I take on a daily basis. Hey guys, welcome back to my channel. Ashley Has Life here today, and we are going to be talking about lupus meds. So, as you may or may not know, I have lived with lupus for over 20 years. Blows my mind every time I say that. But I have been on lupus meds since the age of 12 years old. And so today I'm actually going to be going over the lupus meds that I am currently taking. I've actually been on the same meds since I was 12 years old. And dosages have changed, went up and went down. But for the most part, I've been on the same medications. So I actually got this as a requested video in the comments. Shout out to all of my subscribers. You guys are definitely what keeps me going, because clearly I was going through comments the other night and someone had asked, can you go over your lupus meds? Can you go over different coping techniques, while living with lupus? And it just inspired me to, of course, pick back up and keep going with it. Okay, so one of the first medications that I'm taking for lupus is Sept, which is also known as mycophenolate. And this is the purple pill. It looks like this. I'm actually going to show you guys what it looks like. So it looks like this. It's a purple pill. And in all actuality and honesty, guys, I know some people can go through and they can tell you how the medicine makes them feel, how, it affects them. But I can't do that because I don't have side effects from my medicine. Every medicine causes a side effect, but like I said, I've been taking this medication since I was 12 years old. So I don't know if it's the fact that I just don't pay attention to the side effects anymore, or, but I take my medicine in the morning and I'm going through the day or whatever I'm doing, and I can't tell you what it's doing. And maybe it may be the fact that I'm taking so much medicine that it's like I wouldn't be able to pick out what's doing what anyway. So I'm gonna just throw that out there. But once again, the Sept, known as mycophenolate, is a purple shaped pill. It has some numbers and letters on it. And yeah, so I take this medicine. So Sept is an immunosuppressant used especially for lupus patients with signs of kidney disease. It works by targeting an enzyme in the body, a protein responsible for certain chemical reactions. So this also means it can definitely impact your immune system, lowering it, making you more susceptible to diseases and illness and sickness. But this drug is also possibly a replacement drug for prednisone, which is a good thing. Side effects: asthma, respiratory tract infection, anemia, anxiety, back pain. So those are just a few of the side effects that can come along with this medicine. All right, so the next medication that we're going to go over is the Losartan. So the Losartan was prescribed by my kidney doctor. And if you don't know, sometimes with lupus, you can have kidney issues, you can have kidney nephritis, you can have kidney disease. So I actually have kidney nephritis, which means that there's a bit of protein being spilled in my urine. So this is to help manage that. So this is the pill right here. So this is a little small white pill. It actually used to be green. So I actually have some green ones mixed in here because I just put them all together because they're all doing the same thing. So I'm going to show you them side by side. So this is the Losartan. So first I wanted to explain why they are two different colors. So depending on the manufacturer, the color, shape, sizes can change. So that explains the color difference. So according to the Johns Hopkins Lupus Center, 25 to 30% of people with lupus experience hypertension known as high blood pressure, which is defined as a blood pressure greater than 140/90. But in addition, lupus patients have blood pressures greater than the normal of 120/80. So that being said, the most common causes of high blood pressure in people with lupus are kidney disease and long-term steroid use. So not only is Losartan, also known as Xarelto, used to treat high blood pressure, but it's also used to protect the kidneys from damage that can be due to diabetes. Take in mind, I don't have diabetes, but it's just one of the factors that is also considered. So potential side effects include dizziness, lightheadedness, fainting, weakness, slow irregular heartbeat, rash, itching, swelling, especially of the face, tongue, or throat, and possible trouble breathing. So the next drug that I'm going to talk about is actually a highly publicized drug right now that they actually, I guess, made mention of treating COVID-19 with, but it is the ever so popular hydrochloroquine, also known as Plaquenil. So before it got hype, I was taking this since 12 years old, period. So, like I said, it's helping me sustain life. So I'm taking the Plaquenil. Here is what it looks like. So hydrochloroquine, I know earlier I said quinine, I'm just used to saying it like that. But according to the Johns Hopkins Lupus Center, this drug is really good for improving joint pain, skin rashes, inflammation on the lining of the heart, inflammation of the lining of the lungs, and symptoms of fatigue and fever. Another plus about this drug is that it may prevent spreading of lupus to certain organs like the kidney, the central nervous system, because as we know that lupus can affect all parts of the body from your brain down to your tissues. There have also been some studies done on patients who take this drug that have lupus and have shown that those patients actually live longer than those who are not on this drug. So I'll continue taking it for now. So that's Plaquenil. Okay, so the next drug that we're going to talk about is actually a drug that I did not take since 12 years old. I actually started taking this drug after I had my stroke. So it actually started out with me taking Warfarin. So Warfarin is a blood thinner. And as we know, strokes are caused from blood clots. So I need to be put on a blood thinner in order to prevent future blood clots. So the first one that we tried was the Warfarin. Now the Warfarin is a peachy looking pill. It looks like this. So Warfarin, also known as Coumadin, is known as an anticoagulant, and being that it thins the blood, basically used after you have a stroke, heart attack, and you need to have your blood thin. What I did not like is that you have to continuously watch for internal bleeding, you have to continuously watch for bruises, all those things, and you have to be monitored. So that was really hard for me. So being that you had to continuously monitor the numbers with the Warfarin, it wasn't working for me because my numbers were never right. I couldn't get it to be where it needed to be. And that was part my fault, part I'm going to say the drugs part the drugs fault. But I then started taking Xarelto. So Xarelto is a drug that does not have to be monitored by the doctor. You just take it daily. I take mine once a day. I'm taking 20 milligrams of it. And I don't have to worry about anything. I can eat whatever I want. So with the Warfarin, you can't eat leafy green vegetables, certain foods, because it affects the medicine. And so with the Xarelto, I don't have to worry about that. I can eat whatever I want, and I love it. So this is what it looks like. So Xarelto is also considered an anticoagulant, and it works by blocking certain clotting proteins in your blood. So some side effects include easy bruising, minor bleeding like nosebleeds. All right, last but not least is what I call my life-sustaining drug. Now, I don't want to say that I'm dependent on this drug, but this is the drug that basically makes me feel good, helps me get up in the morning, makes me keep going. And that is my prednisone, also known as steroids. Now, I actually don't have the bottle with me, but it's a small white pill. They come in a variety of sizes and shapes. Now, well, they're all circles, but yeah. So I don't want to say that I depend on them, but I kind of do, because like if I notice the difference. This is a drug that I notice if I don't take it. So if I don't take my steroids for like a day or two, my bones will start to feel like bricks. Like my body will just start hurting. I'll be tired, extremely fatigued. Like it's crazy. Now, when I was first diagnosed with lupus, I was taking IV bags of steroids, ridiculous amounts of numbers of milligrams, and it caused psychosis, okay? So that's the first point. Now, later on in life, I've been everywhere from 20 milligrams all the way down to 5 milligrams. I'm currently at 8 milligrams. So that's a hand clap right there, because my goal is to get off of the steroids, and this is actually the longest time that I've ever been down that low and able to remain healthy and not in a flare. So I will say that about steroids. I love my steroids, but it's a love-hate relationship, because they have got to go. Like I'm trying to say in general, like my goal is to not be on medicine my entire life. My goal is to eventually transition off of medicine, and I feel like I'm working towards that. Yes, I know having a healthy diet, eating clean, exercise, all those things are what helps you to be able to get off of the medicine, but these are also drugs that have saved my life in a time of need and crisis. So that's the medicine. That's what I'm taking. Please make sure that you like, comment, and subscribe. I hope that I answered those questions for that subscriber that wanted me to do a video on the medicine. So if I did not answer your question, please make sure that you comment it below so I could try to answer your question. And yeah, like I said, I wish that I could tell you like which each one does and how it makes me feel, but I can't do that because I don't have that experience with the medicine, and I think it's just because it's been that long that I've been on them. So I love you guys. I'll talk to you soon. Thanks for watching. Bye.